Hello everyone, this is Anan Khan. I have completed my BMS and recently I am working as an intern in a hospital. So friends, in my previous two lessons, we have discussed about the physiology as well as the anatomy of the digestive system. So today I am with the pathology of the digestive system. I have divided into two parts. Today we will discuss the part 1 of the pathology about the secretions. As we have already discussed in our previous chapters that there are various secretions such as the saliva, bile, enzymes, etc. of the digestive system. So one by one we will deal with the pathology of that. Start with, we'll see the pathology of saliva. So friends, saliva can take place two things. First, hyposecretion or hypersecretion. Hypo, the term means less than the normal amount, and hyper means more than the normal amount. Hyposecretion, that is the reduction in the secretion of saliva, or hypersecretion means excessive secretion of the saliva. So we will begin with the hyposalivation. It can take place in two types. First, temporary hyposalivation, okay, and the second one is the permanent hyposalivation. Temporary hyposalivation can take place in conditions like emotional conditions of fear, fever or dehydration, and permanent salivation can take place in obstruction of salivary duct, congenital absence of salivary gland. Many people do not have salivary gland by birth, okay, so it's obvious that they will have hyposalivation because the gland itself is not present. So the next condition is also Bell's palsy. Bell's palsy is nothing but the paralysis of the facial nerves. These are the conditions of permanent hyposalivation. Now moving forward to the hypersalivation. Hyper means more than the amount. So there are two conditions of hypersalivation. First is the physiological condition, okay, and the second one is the pathological condition. Physiological condition, friends, is the condition when the woman is pregnant, okay. So the women in the case of pregnancy experience hypersalivation. That is the physiological condition. But what about the pathological condition? This can be the diseases of esophagus, diseases of stomach, diseases of intestine, or in case of nausea and vomiting, or some psychological or psychiatric condition. That is the case of hypersalivation. Okay, in that sequence also there are some more pathological condition of saliva that are xerostomia. Xerostomia is nothing but the dry mouth, or you can also call it as cotton mouth. The cause for this is due to hypersalivation or absence of salivary secretions in conditions such as the dehydration, renal failure, shock, trauma to salivary gland and their ducts. Xerostomia takes place. The second condition is the drooling. Drooling is the uncontrolled flow of saliva outside the body, okay. Causes due to excess production of saliva, okay. When the saliva is produced in excess amount, the mouth is unable to retain it inside itself, so it takes it out. So it is known as the drooling. So friends, this can be seen in the teeth eruption procedure in the children, or in case of tonsillitis, or in case of upper respiratory tract infection or nasal allergies, especially in the children's. So that's all for the saliva. Now we will deal with the another pathological condition, and which is very commonly seen nowadays, that is the condition of gastritis. Gastritis is the inflammation of the gastric mucosa. Friends, this gastritis is of two types. First is the acute gastritis and the second one is the chronic gastritis. Acute means simply the inflammation of the superficial layer of the mucous membrane, okay. The cause for this acute gastritis can be the infection with Helicobacter pylori. This Helicobacter pylori is a type of bacteria that causes acute gastritis. The other cause can be excessive alcohol, excessive use of NSAIDs, or the repeated exposure to radiations. That's all for the acute gastritis. Moving forward to the chronic gastritis. Chronic gastritis is the inflammation even of the deeper layer of the mucous membrane. In acute, it was only involving the superficial layer of the gastric membrane or the mucous membrane, but in chronic, it involves the superficial as well as the deeper layer of the mucous membrane. The cause for chronic gastritis is also Helicobacter pylori, but its prolonged infection is the cause, or its chronic infection is the cause. And the next one is the autoimmune diseases, or the chronic use of alcohol can also called the chronic gastritis. Now we will deal with the symptoms of gastritis. Generally the symptoms are non-specific for gastritis, okay, but some common features are seen, that are abdominal upset or pain with burning sensation. This pain is experienced in the region of epigastric, so we call it as epigastric pain. The next is the nausea followed by vomiting. Then the other symptom is anorexia. Anorexia means loss of appetite, okay. And the next is indigestion, and finally belching. These are some symptoms of gastritis. Now moving forward, another pathological condition of digestive system is gastric atrophy. Gastric atrophy can be defined as the condition in which the muscles of the stomach shrink, okay. The muscles of the stomach shrink and they become very weak. Due to this, what happens? This results in the deficiency of gastric juice, okay, and its cause can be chronic gastritis, as we have discussed earlier. The next condition is the peptic ulcer. It is defined as the ulcer in the wall of the stomach or duodenum, which is caused by digestive action of digestive or gastric juice, okay. If the peptic ulcer is found in the duodenum, it is known as the duodenal ulcer, and if it is found in the stomach, it is known as the gastric ulcer. So friends, what are the causes of peptic ulcer? Peptic ulcer can result in people who uses excessive spicy food, who have constant physical or emotional stress, hyperactivity of the gastric juice, long-term use of NSAIDs, and person who smoke. The symptoms are nausea, vomiting, hemoptysis, that is vomiting will be seen but with blood, burning pain in the chest, anorexia, you know all, that is loss of appetite, and lastly is the loss of weight. See, here is a point to be remembered in the peptic ulcer, that if the pain occurs in a person while eating or drinking, okay, that particular time if the pain occurs, then it is peptic ulcer. But if the pain occurs after 1 to 2 hours of the intake of food or during the night, then it is a case of duodenal ulcer. This is a differentiation point for all. So friends, that's all for the pathology first part. Hope you all understood. In next I will discuss some major diseases. Till then, take care. Thank you.